that sells to minors will face no offense, no charges, and no fines. It simply boggles the mind that Health Canada has made it legal for flavoured nicotine products from Imperial Tobacco to be sold to children. This is the first time in more than 100 years in Canada that it is legal to sell to children nicotine products from a tobacco company. Il est complètement incroyable que Santé Canada a rendu légale la vente aux enfants de produits nicotiniques d'Imperial Tobacco. C'est la première fois en plus de 100 ans qu'il est légal de vendre à des mineurs au Canada un produit nicotinique d'un fabricant de tabac. Il est essentiel que les ministres fédéraux de la Santé prennent des mesures immédiatement. What has happened is incomprehensible, but it has happened. Now it needs to be fixed. While the decision was made by departmental officials prior to Minister of Health Mark Holland and Associate Minister of Health Yara Sachs being appointed, it is now up to these ministers to take necessary action. In a few minutes, we will outline what should be done. But first, over to Cynthia.
Hello, my name is Cynthia Callard. I'm the Executive Director of Physicians for Smoke-Free Canada. I'm not a doctor. In addition to the law banning sales to children, tobacco sales to children that's over 100 years old, over the last 35 years, federal and provincial governments have expanded the protective measures for children. These include bans on celebrity endorsements, bans on flavorings, bans on advertising, bans on displays at retail, increased prices through taxation, health warning labels, bans on smoking in schools or vaping on schools, and public education. These measures work. For baby boomers, like my generation, 2 in 3 children, 2 in 3 adolescents, by the time they reached adulthood, 2 in 3 had experimented with these products. And of those who ever tried smoking cigarettes in those age groups, 1/4 still do. Nicotine is powerfully addictive. Among the next generation, the Gen X generation that had some protections, tobacco companies were still able to recruit 1 in 2 individuals. But among those who were born at the turn of the century, who grew up with a world where the protective measures were in place, they've only been able to recruit about 1 in 8. It beggars belief that Health Canada is introducing a product without these protective measures in place. It beggars belief that they introduced this without informing the provincial government so that they could ready their laws. It beggars belief that they didn't apply the knowledge that they have about how tobacco industries work. This regulatory gap can be closed. Provincial governments can impose restrictions on retail. The federal government can require adequate packaging. But it's going to take time. We're not calling for a ban on these products. What we're calling for is a suspension of their sale until measures can be put in place to protect children in the nicotine market.
Good morning. My name is Terry Dean, and I'm President and CEO of the Canadian Lung Association. We are highly concerned about the introduction of nicotine pouches in Canada as currently approved for sale. As you've heard, nicotine is a highly addictive drug, one that can lead to a lifetime of addiction. For years, we've watched as the tobacco companies have identified innovative ways to keep people addicted to nicotine. This is yet another example. Worldwide, countries are scrambling to address this new product. Some are banning the recreational use, others are strictly regulating. In Canada, the application from British American Tobacco, Imperial Tobacco, as a nicotine replacement therapy has allowed tobacco companies to once again promote their products in a way that sells a lifestyle, clearly appealing to young audiences, in ads and on social media. And you only have to check out their social media feed and you'll see what I mean. This is something that has been restricted in Canada for quite some time. The places that people can smoke in Canada have increasingly diminished over the years, and these ads clearly highlight the opportunity to use these nicotine products now in those places. This is concerning for new generations, as we potentially triggering those who have already quit, and clearly it is something of serious concern. We should all be concerned about this. I'll pass it over to Stephanie from Heart and Stroke.
Hello, I'm Stephanie Lawrence. I'm here representing Heart and Stroke, who, along with our partners here today and many others who aren't in the room, have been working on tobacco and nicotine control issues for decades. I'm also here today as someone who has been personally touched by tobacco industry products. I smoked in high school and university, and it was difficult to quit. My mother died 3 weeks ago today from smoking, emphysema and lung cancer, after years of living with chronic and increasingly debilitating illness. She started smoking in the 50s when they were marketed as a lifestyle choice, and at the time most of her friends smoked. She tried to quit many times. Now, as a mother and an aunt to young people in their late teens to mid-20s, I'm surrounded by young people who vape. Young people who are drawn in by fun flavors, aggressive lifestyle marketing, peer pressure, and social influencers. And they're now all addicted to nicotine. Some of them now smoke cigarettes as well. So what I've seen, and what I know is worrying to other parents, is nicotine products leading to smoking, not nicotine products leading to quitting. These products are all from the same industry, an industry that's updated its playbook to sell its addictive and dangerous products to a new and young customer base. There's much more work to be done to support adult smokers to quit smoking. But allowing the tobacco industry to target our youth with its addictive products is not the answer. We have a small window of opportunity to keep these flavored nicotine pouches out of the hands of the next generation. We missed that opportunity with e-cigarettes when they were legalized, and we should not miss the opportunity we have before us today. Thank you. Now, Flory will speak.
Thank you, Stephanie. Bonjour, je suis Flory Douka, je suis la porte-parole et la co-directrice de la Coalition québécoise pour le contrôle du tabac. I'll start my remarks in French, reiterating some of the points that were made by my colleagues. C'est pour la première fois depuis une centaine d'années, on a permis à un cigarettier de commercialiser et de vendre en toute légalité des produits contenant de la nicotine à des enfants, et ce, partout au Canada. Ces produits, des sachets de nicotine, sont addictifs, sentent bon, goûtent bon et sont présentés dans toutes sortes de saveurs qui sont attrayantes, comme la menthe rafraîchissante, prise tropicale. Et bien que le produit ait été autorisé pour l'arrêt tabagique comme substitut nicotinique pour les adultes, comme par le passé, le distributeur au Canada, un fabricant de tabac, en fait la promotion de façon attrayante à travers des publicités style de vie qui présentent l'usage des produits par des jeunes adultes auxquels aspirent nos jeunes, dans des endroits sociaux, avant de faire la fête, dans le contexte d'un match sportif, etc. Avec des slogans accrocheurs, avec des publicités qui peuvent être vues par tout le monde à travers les réseaux sociaux, puis peut-être même bientôt à la télé. Ce puissant type de marketing a associé un produit de nicotine. Il est clair que nos jeunes tomberont dans le même piège, comme on a vu pour les produits de vapotage. Malheureusement, les produits et leur marketing tombent dans des flous réglementaires. Ni couverts par la loi sur le tabac et les produits de vapotage, qui est censé protéger nos jeunes contre le marketing des cigarettiers, ni adéquatement réglementés pour les protéger en termes de marketing et de mise en marché. On peut donner des échantillons, par exemple. Il n'y a aucune province où la vente des sachets nicotiniques aux mineurs est illégale. C'est pourquoi nous interpellons le ministre de la Santé, Mark Holland, et sa collègue, la ministre déléguée, la ministre Sachs, à intervenir rapidement. On demande à ce que deux choses. Un, de redéfinir les sachets nicotiniques à titre de produits exigeant une ordonnance, ou de suspendre les sachets, la vente des sachets jusqu'à ce qu'on ait pu combler le vide réglementaire. Ces deux approches peuvent se réaliser rapidement à travers des décrets, des avis ministériels, sans les lourdes analyses qui sont nécessaires pour changer la réglementation. Aussi, parce qu'on sait qu'il y a d'autres applications de produits qui font l'objet de regards de Santé Canada et que des concurrents d'Imperial Tobacco voudront eux aussi mettre sur le marché le produit, on demande à ce qu'il y ait la mise en place d'un moratoire temporaire en ce qui concerne l'approbation, en vertu du règlement sur les produits de santé naturelle, de nouveaux sachets ou de tout autre produit nicotinique, à moins que ces derniers soient vendus sous ordonnance. In light of the appeal and aggressive advertising that is being used to market these products, their addictive and attractively flavored packaging and product, we ask that Minister Holland and Minister Sack intervene immediately until the regulatory gaps that were highlighted by my colleagues are filled. This will take time, and so that's why it's important for these federal ministers to act promptly. We ask that they reclassify nicotine pouches as a prescription product or to suspend the sale of nicotine pouches until the regulatory gap is closed. These are approaches that can be done swiftly without a regulatory amendment. They can just simply be done administratively. And because we know that there's other applications and other companies looking to put on the market similar products, we are hoping that government will establish a temporary moratorium on the approval of any more nicotine pouches or any new category of nicotine products under the Natural Health Product Regulation until the regulatory gap is closed. We are not looking just for concern, we're looking for immediate action. Thank you.
So that concludes our initial statements. We're welcome for any questions that there may be.
What do you see is, how serious do you think this is going to become if Canada does not take action swiftly, as you're requesting the federal government to do?
Well, we know that Imperial Tobacco and the tobacco industry is very skilled. And they have a long history of recruiting underage youth to their products. It's going to become a very significant problem unless action is taken. The good news is it is possible to take action very, very quickly.
So what, you mentioned classifying it as a prescription. Can you provide some clarity as to what you would like the federal government to do immediately?
So there's two options. One is that this can be classified as a prescription-only product. That is very easy to do. At the moment, it's classified as a non-prescription. If it's prescription, it'll be sold in pharmacies only, and you'll have this medical intervention before it can be provided to anyone. That way, youth, young adults, non-users, non-smokers will not have access to that product, as is currently the case. Another option is for Minister of Health to use the power in Section 19 of the Natural Health Product Regulations to immediately suspend the sale of the product. This would give an opportunity for the regulatory system to catch up, or for there to be other action, whether it's to make it prescription only or to take other action until we have a proper regulatory framework in place to protect youth.
When you say making it as a prescription, is that something that's been done in the past? And I ask that because I can't imagine any doctor writing a prescription for a nicotine product.
Well, nicotine gum originally started as a prescription product, and then it's now on a non-prescription basis. So, with the experience of nicotine gum, nicotine lozenges, nicotine patch, there is a mechanism, that can be provided. Youth do not use nicotine patches, nicotine gum, but the experience in other countries is they use nicotine pouches, and they're certainly promoted by tobacco companies as a youthful lifestyle product. That should not be happening. And we know that convenience stores are notorious for failure to comply with sales to minors laws. Now there's not even a sales to minors law that has to be obeyed. It's just a matter of time before there's going to be widespread use unless action is taken.
What do we know about the health risks of inserting a pouch into your mouth?
We know very little, actually, about the health effects of these products. I think there are reasons that many people would consider them safer than smoking, but when it comes to a young person's use, that's kind of an irrelevant consideration. The problem with these products and other new products that are on the horizon is that they are introduced without any disclosure, particularly of any testing, any mandatory testing, any testing by government, any sense about what the population health impact is. Other systems, including the United States and including Australia, have taken a more precautionary approach to say that these cannot be launched onto the market without the drug regulatory system in place. Arguably, Health Canada will say that they've applied the drug regulatory system, but they haven't done so in a way that has integrated into it a requirement for post-market management in a way that won't reach children. They're using the wrong tool. But the quick answer to your question is we don't know, in the same way we didn't really know how dangerous cigarettes were 100 years ago. It's waiting for a whole generation to use these products before we have available epidemiology is not useful. Assuming that they might be appropriate under some circumstances for smokers to use, that's a different question. That's why we're not calling for their ban, but more for their use in a constrained way.
Fundamentally, is there a difference between nicotine chewing gum and this from a medical perspective?
Well, we don't know. That's one, as highlighted by my colleagues. But we do certainly see the advertising and the promotion regarding this product as being very different from what we've seen from other approved cessation products. You're seeing young adults as part of lifestyle advertising. The pharmaceutical industry didn't go there. You're seeing them in convenience stores. NRTs can be sold. It can be sold in convenience stores, but typically manufacturers have not gone to those spaces, knowing that they'd be easily accessible to youth. And so I think that one of the key concerns is that the national product regulation framework is just not equipped to deal with the tobacco industry's history of marketing and deception.
In any of your estimation, is it better to smoke, vape, or use these pouches?
For Charles, no.
This is a product that can legally be sold to kids, and most of those kids don't smoke. They should have no interest, and the product should not even be offered to them.
But if you're an adult?
The product can be available on prescription, just as other products are. So this is not about removing the product from the market. It's about not making it readily available to children, for sale to children, and by not making its marketing appealing to children.
You touched on it a bit, but what is your concern specifically about the way that this product is being marketed and sold?
Well, the concern is that there's a near absence of restriction on promotion of the product, and it is legal to sell nicotine pouches to children of any age. There are not the restrictions in place that exist for the sale and marketing of tobacco products or vaping products. There's a huge regulatory gap. It should not be allowed to be on the market in the absence of proper regulations to protect youth. We know that some other countries, because of the problems that have existed and the marketing strategies of tobacco companies, Belgium and Netherlands, for example, have either banned these products or are in the process of banning them altogether because because of the marketing strategies. There is a photo on the screen in the room of an ad for this product on the countertop of a convenience store next to confectionery, chocolate bars. That is simply not the way nicotine gum and nicotine patches are marketed. We cannot trust tobacco companies. The Supreme Court of Canada has recognized that there are internal documents that they've advertised to underage youth. We've just had a really difficult, and we still are, with respect to vaping products and a lack of regulation. And it seems like we're starting all over again with a regulatory void.
Where is the legislation at with vaping right now?
So there are federal and provincial laws that prohibit the sale of vaping products to youth, depending on the age, varies, 18, 19, or 21, depending on the province or territory. There are significant restrictions on advertising. You cannot have any vaping product promotions that are exposed to youth. Thus, you can't have them in convenience stores. You can't have them on billboards. They can't be on television. They can't be on the internet. That is not the case for these nicotine pouches. there's a wide open exposure in terms of where they can be promoted. And with respect to vaping products, you cannot have people in ads, you cannot have lifestyle ads, but for nicotine pouches, you can. So there needs to be a catch-up. The natural health product regulations do not have experience dealing with the tobacco industry, dealing with addictive drugs such as nicotine, with an industry of such behavior. So it's essential that we catch up, we pause, and we have proper protections in place for youth.
Is this what happened with vaping as well? Do you feel like this is a trend where the tobacco industry comes out with a new product, they find a way to kind of circumvent whatever the legislation is, and then the federal government or the provincial governments are playing catch up?
Absolutely, it's a game of catch-up. I just want to put a footnote on what my colleague said. You'll remember in 2018 when vaping products were legalized, there were no restrictions at that time on other than some put in by some provincial governments. So in Ontario, for example, it was legal to have signs in convenience stores. There were lots of lifestyle ads on Instagram. The federal government didn't clamp down on the advertising for over a year. They waited for the problem to become apparent. They waited for the first surveying tools to come back so that they knew how many young people were doing them. They looked at them with alarm and they pulled back on the marketing permissions. In this case, there isn't even a survey on the ground to let us know how many young people are going to be using nicotine pouches. It's not included in our surveys. It's not intended to be in our surveys until for at least a year, as far as we were informed by the government. So it's going to be very difficult. What we're really suggesting is that we have to learn a lesson from the vaping experience. Don't close the barn door before the horse leaves, and take a moment, act immediately, close this barn door, fix the laws, and then permit them for sale in a way that protects children.
The horse leaving, is that a concern that young people are going to be addicted to these before legislation comes in to prevent them from seeing them in stores?
Absolutely.
Really? Anyone?
I'll just check online. If you have a question, please raise your hand. Si vous avez une question, s'il vous plaît, ici, levez la main.
If not, I have one more. Okay. You mentioned that we really don't know what sort of impact these pouches could have on young people. Do we know the potential impacts of 4 milligrams of nicotine on a child or young person, either in the short term or long term? And could that give us any sort of inclination as to what this could cause?
I think we're all hesitant to speak on medical advice or science because there are people who are better qualified than ourselves. But if you look at statements of the Canadian Pediatric Society where they talk about the risks to the adolescent brain of nicotine use, the fact that the younger you use nicotine, generally speaking, the more addictive, the more likely you are to have difficulty overcoming your addiction later. And there are concerns about permanent damage. There are real pediatric reasons to be concerned. Another major element is that essentially nicotine addiction is a pediatric disease. Most people who become addicted to nicotine do so before they are, during their adolescence. And so if you can protect people from experimenting with and becoming addicted to nicotine, you've essentially dealt with the problem at an adult level as well. So I would actually refer you to the Canadian Pediatric Society or others for these particular scientific issues with youth brain, but you will not have difficulty finding someone who will be able to assure you of those problems.
Why do you think it is that the federal government has not acted sooner and, like you said, learned from the vaping experience?
Right hand, left hand.
So the natural health products regulations don't have any experience dealing with the tobacco industry. And I think that there is a process for hundreds of products that is applied. But this is an outlier. It contains an addictive drug. It is marketed by the tobacco industry. And we need to deal with that. So it's unfortunate what's happened, but there are remedies available. And the sooner remedies are implemented, the sooner youth will be protected.
I believe this concludes the press conference. Thank you.
Thank you very much for taking our questions.
Thank you.